Cholera, an acute diarrheal infection, has plagued humanity for centuries. It is caused by the bacterium. This bacterium thrives in environments with poor sanitation. Cholera spreads primarily through contaminated water and food. The disease can quickly escalate into a public health crisis, especially in vulnerable populations. Cholera remains a significant global health challenge. It affects millions of people worldwide, particularly in developing countries. The World Health Organization, or WHO, estimates that cholera causes up to 143,000 deaths annually. These numbers highlight the urgent need for effective prevention and control measures. Understanding the causes, transmission, and prevention of cholera is crucial. This knowledge empowers individuals and communities to protect themselves. By implementing proper sanitation practices and ensuring access to clean water, we can significantly reduce the burden of this preventable disease. Cholera transmission occurs primarily through the fecal-oral route. This means that the bacteria from an infected person's feces can contaminate water or food. When another person ingests this contaminated water or food, they can become infected. The most common sources of cholera transmission are contaminated drinking water and food. Inadequate sanitation systems, particularly in crowded areas, can lead to the contamination of water sources. Street food vendors who do not have access to clean water or proper hygiene practices can also contribute to the spread of cholera. Even a small amount of contaminated water or food can transmit the bacteria. This highlights the importance of being vigilant about food and water safety, especially when traveling to areas with a high risk of cholera. Cholera outbreaks often occur in areas with inadequate sanitation and limited access to clean water. These conditions create a favorable environment for the bacterium to thrive and spread rapidly. Overcrowded urban slums and refugee camps are particularly vulnerable to outbreaks. Natural disasters, such as floods and earthquakes, can also trigger cholera outbreaks. These events often disrupt sanitation systems and contaminate water sources, leading to a surge in cases. Similarly, conflicts and humanitarian crises can increase the risk of cholera due to displacement, limited access to healthcare, and poor sanitation. Understanding the factors that contribute to cholera outbreaks is essential for implementing effective control measures. This includes investing in water and sanitation infrastructure, promoting hygiene education, and ensuring rapid response during emergencies. Cholera infection can manifest with a wide range of symptoms from mild to severe. Some individuals infected with may not experience any symptoms at all, yet they can still shed the bacteria in their feces, contributing to the spread of the disease. The hallmark symptom of cholera is profuse watery diarrhea, often described as rice water stools due to their appearance. This severe diarrhea can lead to rapid dehydration, which can be life-threatening if left untreated. Other common symptoms include vomiting, muscle cramps, and weakness. In severe cases, cholera can cause rapid fluid loss, leading to electrolyte imbalances, shock, and even death. Prompt treatment is crucial to prevent these complications and improve the chances of survival. Section 5. Identifying the culprit, diagnosis of cholera. Diagnosing cholera typically involves a combination of clinical evaluation and laboratory testing. Healthcare professionals will consider the patient's symptoms, medical history, and potential exposure to contaminated water or food. A stool sample is usually collected and sent to a laboratory for analysis. The laboratory can identify the presence of bacteria in the stool, confirming the diagnosis. Rapid diagnostic tests are also available in some settings, providing quick results and facilitating timely treatment. Early diagnosis is crucial for initiating appropriate treatment and preventing the spread of the infection. In areas with a high prevalence of cholera, healthcare providers may have a high index of suspicion and initiate treatment based on clinical symptoms alone, even before laboratory confirmation is available. Section 6. Combating the infection treatment strategies for cholera. The cornerstone of cholera treatment is rehydration therapy. The goal is to replace the fluids and electrolytes lost through diarrhea and vomiting. Oral rehydration salts, or ORS, are highly effective in treating most cases of cholera, especially in the early stages. ORS is a simple and inexpensive solution of sugar, salt, and water that can be easily administered at home. In severe cases, intravenous fluids may be necessary to restore fluid balance more rapidly. Antibiotics can shorten the duration of diarrhea and reduce the severity of symptoms, but they are not a substitute for rehydration therapy. Zinc supplements have also been shown to be beneficial in reducing the duration and severity of diarrhea in children. Prompt and effective treatment significantly reduces the risk of complications and death from cholera. Access to timely and appropriate health care is essential for improving outcomes and reducing the burden of the disease. Section 7. Shielding ourselves: preventive measures against cholera. Preventing cholera requires a multi-pronged approach that addresses both individual and community-level factors. Access to safe drinking water and adequate sanitation facilities is paramount in preventing the spread of the disease. Individual hygiene practices, such as hand washing with soap and water, especially after using the toilet and before handling food, are crucial in breaking the chain of transmission. Food safety measures, including washing fruits and vegetables thoroughly and cooking food to the appropriate temperature, are also essential. Vaccination against cholera is another effective preventive measure, particularly for individuals traveling to areas with a high risk of the disease or living in endemic areas. Public health education campaigns play a vital role in raising awareness about cholera, promoting hygiene practices, and encouraging vaccination. Section 8. A unified front: global response to cholera outbreaks. Controlling cholera requires a coordinated global effort. The World Health Organization, or WHO, plays a leading role in coordinating international efforts to combat cholera and other diarrheal diseases. The WHO provides technical assistance to countries, supports surveillance systems, and coordinates the delivery of essential supplies during outbreaks. Rapid response teams are deployed to affected areas to assist with case management, implement control measures, and provide training to local healthcare workers. The Global Task Force on Cholera Control, or GTFCC, a network of partners led by the WHO, aims to reduce cholera deaths by 90% by 2030. International collaboration is crucial for sharing information, coordinating resources, and supporting countries in their efforts to prevent and control cholera. Section 9. The aftermath: long-term effects of cholera. While most people recover fully from cholera with appropriate treatment, some individuals may experience long-term health effects. Repeated episodes of severe diarrhea can lead to malnutrition, stunted growth, and weakened immune systems, particularly in children. Post-infectious irritable bowel syndrome, or IBS, is another potential long-term complication of cholera. Individuals with post-infectious IBS may experience abdominal pain, bloating, diarrhea, and constipation long after the initial infection has cleared. Addressing the long-term health consequences of cholera requires a comprehensive approach that includes nutritional rehabilitation, access to healthcare, and ongoing monitoring for complications. Section 10. Beyond the horizon: research and advancements in cholera. Scientists and researchers continue to make strides in understanding, preventing, and treating cholera. Ongoing research focuses on developing more effective vaccines, improving diagnostic tools, and exploring new treatment options. One promising area of research is the development of oral cholera vaccines that provide long-lasting immunity with a single dose. These vaccines could revolutionize cholera prevention, especially in remote areas and during emergencies. Researchers are also exploring the use of bacteriophages, viruses that infect and kill bacteria, as a potential treatment for cholera. Continued investment in research and development is essential for advancing our understanding of cholera and developing innovative solutions to combat this deadly disease. Section 11. Conclusion: cholera, a global challenge demanding our attention. Cholera remains a significant global health threat, disproportionately affecting vulnerable populations in developing countries. The disease is preventable and treatable, yet it continues to cause unnecessary suffering and death. Access to safe drinking water, adequate sanitation, and proper hygiene practices are fundamental to preventing cholera. Early diagnosis and prompt treatment with rehydration therapy are crucial for improving outcomes and reducing mortality. Global collaboration, sustained investment in research, and a commitment to strengthening healthcare systems are essential for eliminating cholera and protecting future generations from this preventable disease.